Hi, all. My name is Brian Modis, Government Relations Director at NASW Texas. I want to provide all of you with a government relations update on what's happening at the Capitol, what kind of bills we're monitoring, and also just our champion bills and how you can get involved this legislative session. So we're about 1 month into the legislative session, and so far, what has happened is the Lieutenant Governor has made committee assignments to the State Senate. There have been some shifts in roles and chairs within the Senate, but the Senate Health and Human Services Committee remains at the same chair, just a new addition to members in there. That's where we see most of our bills really go through, and those that we are really monitoring. Now, with that being said, the House, we are still waiting for the Speaker to release those committee assignments, which should be out in the next couple of weeks here, and we'll make an announcement on our social media platforms once that does happen. But in the meantime, the Senate is off and starting their committee hearings on the base budget. The base budget was released just a couple of weeks ago, both the House version and the Senate version. These are the introduced versions of the budget that both chambers have proposed. There are very few differences on these bills, particularly when it comes to funding for mental health care and a few other items. This rarely ever happens. It's kind of surprising to see this many similarities with them, but there is some exciting news to celebrate within both base budgets. And again, this is the introduced version of the budget. It will still go through the process of conference committee where the House and Senate get together and decide what to fund exactly and settle those little differences. But so far, what we can tell based on the base budgets, the increase for the mental health loan repayment program that we had been asking for over the interim with many other mental health advocates in this space and that we partner with closely, they've decided to increase the funding from $2 million for the biennium to now $28 million in just the base budgets. This is a really strong indicator that a lot of work that we had done over the interim with our partners has really paid off. Now, we still, like I said, need to go through the legislative process with the bill, but this is a strong indication that shows the legislature is willing to make the investment in this program to try and get more folks accepted into it. If you haven't had a chance to look at the mental health loan repayment one-pager that we have, we're going to be putting it up on the site shortly. We developed it, or we have our Texas Coalition for Healthy Minds that helped really develop that one pager, but check it out on our website if you haven't already. Next, I want to talk to you all about the status of some of our champion bills. As some of you may know, some of the bills that we are introducing this session are refiles from the past, such as the definition and codification of what school social work services are into the education code. This is a bill that has been authored, House Bill 316 by Representative Bernal in the House, and we are waiting for language to come back in the Senate side for a modified version that would direct schools to adopt a policy where school social workers would be dedicating 80% of their time to the defined services in the bill. This is to be able to really make that distinction of what the role of a school social worker is compared to that of a school psychologist or school counselor. We're excited to bring this bill back, and with so much attention on mental health and student mental health this session, we're hopeful that it'll pass and get a hearing this session. Next, we also have our pay parity bill. This is the one that closes that gap for Medicaid reimbursement psychotherapy services for LCSWs, LPCs, and LMFTs to that of 100% reimbursement rate with the psychologists and psychiatrists, while also in addition allowing for those professionals, LPCs, LMFT associates, and LMSWs under supervision to bill Medicaid at 70% of the reimbursement rate for psychotherapy services. This bill has been filed in the House already by Representative Moody, House Bill 1396. There's a one-pager on our website that you can check out there if you want to learn more about it. The Homes for Heroes bill has also been filed by Representative Guillen in the House. I don't have that number at the top of my head, but we have the one pager also available on the website for you to take a look at. We're also going to be taking on a new initiative this session that involves paid practicums for social work students. Now, with this initiative, we put our heads together with the working group of faculty from all across the state that work with students completing their internships. And we want to make sure that we're pushing this initiative that allows social work students both at the bachelor's and master's level with a priority to HBCUs and Hispanic serving institutions and students with the financial qualifications based on FAFSA information to qualify for this stipend program that would be housed under the Texas Higher Ed Coordinating Board's budget. On February 7th, the Senate Finance Committee will be reviewing the budget for the coordinating board and taking recommendations on what other funding should be included in it. This is your opportunity to get involved. If you aren't able to come to the Capitol in Austin and testify on February 7th, you can always reach out to your state senator and urge them to include funding in the Education Board's budget for this stipend program to social work students. There's also more information on this on our website, along with all the other one-pagers. And lastly, we're also working with Representative Jarvis Johnson's office to identify ways to bring back an alternative path to licensure, given the a report that came out from the ASWB earlier or last summer on the disparities that existed for test takers that are Black test takers and Latino test takers compared to white test takers. So we're working with his office on this bill, waiting for language to come back. That one pager will be up in the next few weeks, so keep an eye out for it. But we're excited to be advocating on this and calling out the injustice that it is when it comes to this exam being impartial and unfair. So lastly, what I want to close out there with is that there are plenty of ways for you to all get involved. And I know all of you are itching to know exactly how you can do that. Well, the first is signing up for Social Work Advocacy Day on Friday, March 3rd. This is where students and professionals alike come together to learn more about what advocacy looks like at the state legislature. We have a great set of panelists all throughout the day in our rally at the South Steps of the Capitol. And if you would like to come and learn more about it and meet with your legislator, we encourage you all to start setting up those appointments with your representatives now so that you have that meeting on the same day of Social Work Advocacy Day. We look forward to seeing y'all there. And if you aren't able to make it, there are plenty more ways to learn more about what we're doing in the advocacy space and for you to get involved. I really encourage you all to sign up for our policy priority webinar on February 22nd. We'll be sure to provide the link underneath this video if you're interested. I'll be going over all the work that we're doing on our policy priorities, from workforce to human rights, health equity, and social justice issues in that space, where we plan to get involved and what we're seeing so far, and many of the champion, and I'll be identifying a little bit more on the champion bills that we're working on this session. It is, again, February 22nd. Please keep an eye out for it and make sure to register. And we also have the opportunity for you to sign up for Voter Voice. This is a tool for us to reach out to you and give you an advocacy alert of when a bill is up in a committee hearing with some information on it. Maybe it's a champion bill of ours. Maybe it's a bill that is attacking a certain marginalized group that social workers work with. Well, we encourage you to check out this advocacy alert and then send any information and your concerns to your representative, expressing the need for them to either oppose or support this legislation. That's all I have for all of you right now. I'm really excited to get you all involved in the advocacy space this session and keep you all posted with updates as they come by. Please reach out if there's anything that you have questions on. My email is on the website as well. Thanks so much.